Hello, this is Dr. Jeff Wasserman from Lake Point Orthopedics and Sports Medicine. I am a board-certified anesthesiologist and interventional pain medicine physician. I would like to discuss with you today epidural steroid injections. What are they exactly, and what are they used for? Before we begin, I would like to explain some common medical terminology. The cervical spine is the upper part of your spine and your neck. When pain originates from this area, it may cause symptoms in the neck, shoulders, arms, or hands. The thoracic spine. This is the middle part of your spine. These vertebrae are less mobile than the cervical spine because they are attached to your ribs, providing stability to your torso. Pain in this region is less common but may feel like stiffness or aching in the back and ribs. The lower back or lumbar spine area bears most of your body's weight and allows for movement like bending and twisting. Pain in the lumbar region often radiates to the lower back, hips, or legs, and is also called sciatica. Radiculopathy is used to describe pain, weakness, numbness, or tingling caused by irritation or compression of a spinal nerve. Cervical radiculopathy may cause symptoms in the arms or hands. As we shall discuss later, epidural steroid injections can help reduce inflammation around irritated spinal nerves, relieving these symptoms. Intervertebral discs are cushion-like structures between each vertebra. They act as shock absorbers and allow your spine to bend and twist. A disc displacement occurs when a disc bulges or herniates out of its normal position. This can compress nearby nerves, causing pain or radiculopathy. Steroid injections target inflammation caused by these issues. Spinal stenosis refers to a narrowing of the spaces within your spine, which can put pressure on the spinal cord or nerve. Spinal stenosis often happens due to aging or conditions like arthritis. It commonly causes pain, numbness, or weakness in the back, neck, or limbs. Epidural steroid injections can reduce inflammation and create more space for the nerves, alleviating symptoms. The spine is a remarkable and complex structure that serves literally as the backbone of your body. It is divided into 5 main regions, each with its specific roles and characteristics. The cervical spine is responsible for supporting your head's weight and allowing for a wide range of motion when you turn your head. The thoracic spine has 12 vertebrae. These vertebrae are connected to your ribs, forming the rib cage. The thoracic spine is more rigid than the cervical or lumbar spine, which limits its motion but enhances stability. The lumbar spine typically includes 5 vertebrae usually, although it is not uncommon to have a 6th or transitional lumbar vertebra. These vertebrae are larger because they bear most of your body's weight and allow for movements like bending and twisting. The lumbar region is a common site for back pain because of its heavy load. The sacrum consists of 5 fused vertebrae. It forms a triangular bone that connects the spine to the pelvis. The sacrum is key for stability and serves as the foundation for the spine. The coccyx, or tailbone, is made up of 3 to 5 small fused vertebrae and may get fractured or dislocated when a person falls onto their buttocks. The sacrum and coccyx together serve as an attachment point for muscles of the pelvis and hip region and provide support when sitting. The spine houses and protects the spinal cord. By understanding the structure and function of the spine and its components, you can appreciate how vital it is for movement, stability, and nerve protection. Between the vertebrae lie intervertebral discs, which act as cushions and allow for flexibility. Each disc has 2 main parts. The nucleus pulposus, a soft, gel-like center that provides shock absorption by distributing pressure evenly. In the annulus fibrosus, a tough, fibrous outer layer that confines the nucleus pulposus inside the disc, preventing it from herniating into the spinal canal, and provides strength to withstand stresses. These discs play a vital role in reducing impact during activities like walking, running, and jumping. As we age, the annulus dehydrates and cracks. This puts us at risk for disc bulging and herniations as we get older. It's rare to see a child or adolescent with a disc herniation because they have hydrated and elastic intervertebral discs. A small displacement of the disc into the spinal canal is called a disc bulge and does not usually cause clinical issues. But larger displacement, termed a protrusion or herniation, can lead to direct spine nerve compression, or if combined with other degenerative processes within the spine may lead to narrowing of the spinal canals, termed spinal stenosis. Spinal stenosis causes pain and weakness within the arms or legs depending upon the location. When someone experiences chronic back pain, leg pain, or neck pain, often due to conditions like herniated discs, spinal stenosis, or nerve root inflammation, we typically start with conservative treatments. These include physical therapy, medications like anti-inflammatories, and lifestyle modifications. However, if those approaches don't bring enough relief after several weeks or months, epidural steroid injections are a minimally invasive option to help manage your symptoms. These injections deliver a powerful anti-inflammatory steroid directly into the epidural space around your spinal nerves, targeting the root cause of pain and swelling. This can provide significant relief and improve your ability to participate in other therapies like rehabilitation. Displaced or herniated discs are the most common cause of radiculopathy pain in patients less than 40 to 50 years old. Spinal stenosis is a more common cause of back pain and radiculopathy for patients over age 50. Pain physicians may also perform epidural steroid injections to confirm specific sites for surgery, called selective nerve root blocks, or for cancer patients who have tumor invading and damaging the spinal cord or nerves. These injections will not change your anatomy in any significant way, but they can reduce inflammation and swelling of spinal tissue, thereby helping to reverse the damaging process that occurs after a disc herniation or even with spinal stenosis. Unlike open surgery, these injections don't use incisions and tissue dissection. There is no lengthy recovery. They're typically done on an outpatient basis, and most patients can return to light activities the same day. The procedure is guided by imaging such as fluoroscopy, a type of X-ray, to ensure precise placement of the medication near the affected nerve. We recommend epidural steroids as a step before considering more invasive procedures like a laminectomy or spinal fusion. Surgery can be highly effective but comes with higher risks, longer recovery times, and more significant lifestyle disruption. In many cases, an injection can delay or even eliminate the need for surgery, especially if combined with ongoing physical therapy and self-care. For some patients, a series of injections over time may provide lasting relief. An epidural steroid injection can be performed with or without sedation. At Lake Point Orthopedics and Sports Medicine, we offer both options. During the procedure, the patient is usually placed face down on the procedure table, limbs padded and head support adjusted for comfort, and vital signs monitored throughout the procedure by anesthesia personnel. After injecting local anesthetic at the needle insertion site, a needle is gently placed using X-ray guidance and the steroid injected into the area of nerve damage along with a local anesthetic to immediately reduce postoperative discomfort. A contrast dye is actually injected before the steroid to confirm the needle is properly located near the targeted nerve and to assure that the needle tip is outside any blood vessel. The four main types of epidural steroid injections include interlaminar, the most common type called transforaminal, catheter-guided injections often utilized for the cervical spine, and caudal injections. Let's look at these types in more detail. The goal of an interlaminar epidural steroid injection is to deliver steroid into the epidural space in your spine. The epidural space surrounds the spinal cord and spinal nerves and contains fat and blood vessels. For an interlaminar injection, the needle is inserted through the skin and soft tissues near the middle of the neck or back and guided to the interlaminar space in the back of the spine between two vertebrae. During a transforaminal injection, a thin needle is carefully inserted through the skin and soft tissues and angled toward the intervertebral foramen, where it is placed just above or below the injured spinal nerve. The fluoroscopy guidance ensures the needle is directed safely and precisely, reducing risk of damage of the targeted nerve. The X-ray in this illustration shows a spinal needle that was placed using X-ray guidance into the right L4-5 intervertebral foramen, then just above the L4 spinal nerve. The injected contrast in black shows the course of the nerve as it leaves the spinal canal and runs inferiorly to combine with other nerves and form the right sciatic nerve. A catheter-guided epidural injection is a bit more specialized. Instead of just placing a needle into the epidural space or intervertebral foramen, we use a thin, flexible tube called a catheter to guide the medication to a very specific area. This approach is particularly useful if the source of your pain is in a hard-to-reach spot, or if previous injections haven't provided enough relief and we want to more precisely direct the steroid to the site of inflammation. This is a common technique used for steroid injections into the cervical spine. For caudal injections, we also utilize real-time fluoroscopy X-ray to carefully guide a thin needle into the lower epidural space through an opening at the base of your spine, called the sacral hiatus. This procedure is usually reserved for inflamed spinal nerves near the lower lumbar spine and within the sacrum. Serious complications after epidural steroid injections are very rare but include bleeding, nerve damage, spinal headache, and infection. More commonly, patients may experience minor side effects from the steroid, including fluid retention, facial flushing, or increased appetite for 1 to 2 weeks. Preoperative instructions for epidural steroid injection include the following. Do not eat or drink after midnight before the procedure if sedation will be utilized. However, you may take blood pressure medications with a sip of water the morning of the procedure, even if you are getting sedation. Please discuss blood thinner and anti-inflammatory medications you take with your physician or office staff, as these need to be discontinued before the procedure, but each medication has unique requirements. Avoid use of GLP-1 inhibitors like Ozempic for at least 1 week prior to the procedure due to anesthesia issues. You may shower the morning of the procedure. If you are having sedation, you will need to be accompanied by a responsible adult who will drive you home from the facility. Post-operatively, you may restart your usual medication regimen immediately, and you can shower the next morning. Avoid swimming or sitting in a spa for at least 3 days after the procedure. You may gradually increase your activity level after 3 days of light activity only. Thank you for listening, and I hope you found this video on epidural steroid injections useful. Epidural steroid injections could be the solution you've been looking for. Designed to target inflammation directly at its source, this minimally invasive procedure provides relief from pain caused by conditions like herniated discs, spinal stenosis, and more. If you are interested in finding out more, please contact us at Lake Point Orthopedics by email or by phone at 972-475-8914.